To record and I'll hit admit all, and then everyone just wait like until Andrea obviously will let you start, but maybe just wait a minute. Here we go. Ready? 1, 2, 3, go.
Hello, everybody. We're going to get started in a few minutes. Thank you for joining us. Welcome all. We'll get started in a few minutes. We are going to get started in just a minute or two. Thank you, everyone, for coming. Hi, Sarah. We're going to get started in about 2 minutes, just letting some other people straggle on. I know it's the evening and everyone's very busy, so we'll get started in about 2 minutes. All right, we're going to get started in about 1 minute. Good evening, everybody. How is everyone doing? I hope everyone's doing okay. So thank you so much for coming. I know it's a crazy time. School is upon us. And those of us that have children or patients or neighbors or family members who have asthma, they are scared. And so this is why we are hosting this beautiful seminar today with our two wonderful speakers. The Kick Asthma School Series really wants us to help feel it more at ease with the insanity that's going on among us with the COVID-19 pandemic and those who have respiratory illness like asthma. So we welcome you. We welcome you as members and guests. We are more than happy to have you for the Chicago Asthma Consortium membership. And this is the kind of stuff that we do. We have several different committees. I'm Andrea Papalardo. I'm a physician, allergist, immunologist, internist, pediatrician, mama. I have a child with asthma. I have asthma myself. And so this is really near and dear to my heart. I'm one of the board of directors for the Chicago Asthma Consortium. And we're always looking for new members and people to get involved so that we can hear from you as an expert from your own perspective. And so I really would like to put a shout out for not only our speakers, but every single person that showed up today, because it shows a commitment for really focusing in on the children and adults with asthma and how we're going to keep them safe during school. Next slide, please. So this is Back to School, Just the Facts. We're going to talk a lot about COVID-19 and the resources for going back to school from a variety of different perspectives. And we have a lot of different people that are already attending the seminar, some within clinical realms, some that are community health workers, some that are family members. Everyone can learn something from each of these speakers, and I'm very excited for what each of them have to offer. And I'd like to thank all of our community partners for really making our expert events possible. If we didn't get ideas from the community within who people want to hear from and what people want to hear about, we wouldn't be able to give you great content like we have tonight and we've done in the past and we'll be doing in the future. Next slide, please, Robert. Thank you. A little bit of housekeeping. So the first part, the video and audio will be shut off. However, there will be plenty of time at the end when we do an open forum for everyone to have their video and audio on and speak and give their mind and ask lots of questions and get really involved. But throughout the presentation, you can do so in another way. You can use the chat feature. And so anytime you have a question, just put it into the chat. And for the first presentation, what we'll do with the Q&A is I will moderate that question and answer session, and then we'll discuss how we'll do with Lorraine's talk. So if you have any questions, put it in the chat for right now, and we'll have the question and answer session. There will also be a webinar evaluation at the end of the presentation, which will be placed into the chat and also sent to you on email so that we can get some feedback on how we're doing. Next slide, please. So if you have any problems with technical difficulties, we know a lot of us have used Zoom during the pandemic, but there's still issues regardless of how much you've used it or not. So Robert's there to help you. He's driving my slides. You can call him or you could email Kim, and her email is right there. Next slide, please, Robert. All right, so today's schedule, Back to School with Asthma, Just the Facts. We are going to welcome our two wonderful speakers, Melinda Fitzgerald and Lorraine Alba. And then near the end, we're going to have time for an open forum where anyone can ask any question that they don't feel like was answered or that they want further explanation on. And this will be a time that you can really ask some of those hard questions and we can hopefully answer them for you. All right, next slide, please. Just a little bit about the Chicago Asthma Consortium. The idea for the CAC is that we want to improve the quality of life for all of those who have asthma within the Chicagoland area. And we do so really through advocacy, education, and collaboration. And we collaborate with many of the community partners that you see on this call today and beyond, medical, public health professionals, business leaders, kind of everyone that would be affected by asthma in many different ways. So help us make an impact by becoming a member, joining a committee, or the board of directors. We'd love to have you. Next slide, please. All right, and so this is just to remind me that we're about to get started. Next slide, please. Okay, we have two wonderful presenters, Lorraine Alba and Melinda Fitzgerald. Melinda Fitzgerald will be going first, and if you can please go to the next slide. I just want to remind you to type all of your questions in the chat box. So one more slide, please. These are upcoming forums, so I'm just going to leave this up as I introduce our first speaker, Melinda Fitzgerald. She's the Mobile Care Chicago's very own nurse practitioner. We were really happy to have her come on board earlier this year. And let me tell you just a little bit about her amazing history of all that she's done. So Melinda, if you can turn on your video and start sharing screen, I will introduce you. All right, she is a certified pediatric nurse practitioner with Mobile Care Chicago, which is a nonprofit organization that uses mobile medical clinics to assist children currently unable to access necessary specialty care with asthma and allergies. She received her bachelor degree in biology from Fisk University and her master's degree in nursing at Rush College of Nursing. She has specialized in the care of children for over 20 years. And this experience ranges from staff nursing to nurse practitioners, experience within primary care. And now she joins me in the Mobile Care Chicago Asthma Van to specialize in asthma and allergy care. Her career has been dedicated to community health and working with the underserved. Through all of her experiences, she does remain, and I can attest to this personally, passionate about the care of children and being a voice for the voiceless. She has been an advocate for immunizations and was honored to present a resolution before the Cook County Board of Commissioners and has been on several pediatric quality committees to assure quality metrics are met. In addition, she has been a guest lecturer at the Rush College of Nursing and at University of Illinois at Chicago College of Nursing as well. She's a member of several organizations of which she would like to highlight NAPNAP, I'm sorry if I said that wrong, Sigma Theta Tau Nursing Honor Society, and she recently became a member of our very own American College of Allergy, Asthma, and Immunology with many of our allergy immunology care providers. So welcome, Melinda, and we look forward to hearing all that you have to share with us. Thank you.
Thank you. I am going to share my screen now. So thank you, Dr. Preparato, for the invitation. First and foremost, I want to say that I too, like Dr. Preparato, enjoyed or understands the anxieties that we feel as healthcare providers, and I'm also a mom of school-aged children. So I understand what that means, trying to get them prepared for school in the fall. There's a lot of information out there, a lot of erroneous information, and hopefully today's presentation can kind of help to ease some of those fears that a lot of you may have. I feel like information definitely helps to empower and makes us to feel a little bit better about things, especially during these uncertain times. So back to school with asthma during COVID-19. So first and foremost, I want to talk about COVID-19. So the coronavirus, as we already know, is invisible to the naked eye, a high-powered microscope. You're able to kind of see these crown-like points that give the virus the name corona, which is crown in Latin. The virus uses spikes to latch onto and pry into living cells where they multiply before leaving and infecting more cells throughout the body. The nose and the throat are considered the key entry points for the virus. And once inside, the virus attaches to these biological hooks that appear on the surface of certain human cells. After they kind of take over the nasal cells, the virus replicates and attempts to spread into other areas of the body. The immune system plays a critical role in defending the body from disease, but it sometimes harms the body by overreacting. And that overreaction is called a cytokine storm. And we usually see this in the more severe cases of COVID-19. So during this storm, immune cells can attack healthy cells, which result in blood clots, blood pressure drops, and organ failure. The Delta variant. This is what we've been hearing about quite a lot. And the reason why is because the Delta variant is more contagious than the original strain. And as you can see here, the graph that's provided by the CDC, the initial strain, one person can infect 2 people, whereas with the Delta variant, one person can infect up to 5 people. So in children before, with the original strain, kids could be asymptomatic or have very mild symptoms. And so now they're becoming more symptomatic, therefore leading them to get tested. And some of those infections do become severe, causing patients to be hospitalized. So at this point, the unvaccinated person remains the biggest concern. And so for our children that are under the age of 12, who are not eligible for vaccinations at this time, they remain our biggest concern. And obviously those over the age of 12 who just haven't been vaccinated yet. Fully vaccinated people with the Delta variant or fully vaccinated people can have breakthrough infections because of the Delta variant. And most of their symptoms are mild. It does not cause hospitalization. And also they have a shorter infectious rate as well. So what are the trends with children? Now, this graph does show July 29th. By the week's end, there was about 71,726 children who were infected with COVID-19. But I think I checked today, and 121,427 children were infected between the time of August 5th to August 12th. And so this is a result of the Delta variant, just like I said in the previous slide, because of how contagious this variant is. So what do we have to protect ourselves from COVID-19? So we have the vaccination. So the COVID-19 vaccine does tell our bodies how to recognize and fight the COVID-19 virus. The Pfizer vaccine, we have emergency clearance for children as young as 12. And of course, the Moderna and the J&J are for 18 years of age and older. The recommendation is to vaccinate to protect yourself against the COVID-19 vaccine. So I've had some parents ask me questions related to myocarditis and pericarditis. So myocarditis is inflammation of the muscle around the heart. Pericarditis is inflammation of the lining around the heart. And so this tends to occur more in teens and in young adults and males predominantly. The signs and symptoms generally occur within a few days after receiving the second injection of the mRNA vaccine, which is the Pfizer or the Moderna. And so those symptoms are chest pain, shortness of breath, feeling of fast heartbeat or flutters. And most of those cases are mild and resolve quickly. But if the patient does have those symptoms, we do tell them to seek medical attention. The side effects for the COVID-19 vaccine are about the same as they are for adults. After the second vaccination, you're more likely to have soreness at the site, redness, low-grade fever, tiredness, and headaches. And these are our normal immune response, similar to what would happen after you receive your flu vaccine. You would have mild symptoms. So COVID and asthma, what do the experts say? So weekly, COVID-19 hospitalization surveillance data does show the rate of hospitalization in children is lower than that of adults, but the rates obviously are increasing now for children. 1 in 3 children hospitalized are admitted into the ICU, which is similar to the rate as adults. The point that I really want to drive home here is that currently there is no evidence of increased infection rates in those with asthma. Also, COVID-19 virus does not seem to cause asthma exacerbations. So if the lungs are in good condition, meaning that you're taking your medications as prescribed, you're seeing your PCP or your specialist, you're having tests done like your spirometry and pheno that are telling us the health of your lungs, then you're better prepared for infection or allergens that could possibly cause asthma exacerbations. So I think that this would make a little more sense if I gave a case study. So here's the case study. So we have a 10-year-old patient that has a history of mild persistent asthma. They're positive for skin allergy tests. They have a positive skin allergy test for mold, ragweed, and have a history of exercise-induced asthma. This patient has been to the emergency room every year since the age of 3. And generally, they go to the emergency room between the months of August and November when they have these exacerbations. They were taking Flovent, 44 micrograms, 2 puffs twice a day, Montelukast 5 milligrams, albuterol as needed, but they are no longer taking any medication. And mom states the patient has not had any symptoms for over a year. And so this case is very common in our practice where people just haven't been, or a lot of our kids maybe have not been having a lot of symptoms. And so here is the first question that this mom asked related to returning back to school. Her first question is, does my child still have asthma? if they haven't had any symptoms since they've been in quarantine or isolation during this time. And so my answer to her is yes. Isolation or quarantine did not cure asthma. The reason why this has probably happened is because there's been a lack of exposure to triggers such as viral illnesses, allergens, lack of exercise. Remember, we've been wearing masks. Kids haven't been in close contact with one another. They may not have been going to the parks or spending time outside where they would be exposed to allergens. They may not be participating in sports as they were before, thus causing the lack of exercise. And so that is 9 times out of 10 why a lot of patients have not been experiencing symptoms, not because they don't have asthma anymore. So our next question is, well, I stopped giving him his medication in the past year. Now that he's going to be returning back to school, should I start giving him his medication? And so what I tell patients is that treatment is geared towards your past medical history, your identified triggers, your symptoms, and the results of your breathing test that we do when you come into our office, spirometry or pheno. And you need to really listen to those recommendations of your healthcare provider that can really tell you where you are with everything. And remember, for this patient, he definitely fit a patient that needs to restart his medication. And it'll make more sense at the next slide. So remember, this is the patient who had a history of allergy to mold, to ragweed, exercise-induced bronchospasms, and his exacerbations occur between August and November. And so we don't just arbitrarily tell every patient, okay, you're going to start school, everybody needs to restart on their medications. It's really based on knowledge of understanding asthma and how exacerbations happen and why they happen. And so there's something called a September asthma epidemic. And so there's 4 things that happen during this time of the fall. So one is hay fever. Hay fever is a general term that's used for late summer allergies caused by ragweed that causes allergic rhinitis, which is inflammation inside of the nose that causes lots of mucus and congestion. And so that plant usually pollinates in mid-August, and it continues to be a problem until the first hard freeze or frost, which is usually November. There's also lingering warm weather, unseasonably warm temperatures that help to breed mold, especially if it's really humid like today, or when the weather gets really dry and windy. Leaves is an issue. Leaves are an issue. So raking the leaves, doing the lawn care, it actually agitates pollen and mold into the air, as well as school allergens. So remember, when they go back to school, they haven't been exposed to certain things in months, but now they're exposed to chalk dust, classroom pets. They're sitting in a cafeteria that may have food allergens, even though they're not necessarily consuming them. They're still in one place with everybody eating things that maybe they would be allergic to. And now they're doing PE or gym. So knowing all of these things and understanding our patient's history, that justifies us needing to start him on his medications before school starts. So now mom asks the question, okay, I'm ready. I'm okay with him going back to school, but when he goes back to school, how do I know the difference between COVID-19, asthma, and allergies? And we know now that the COVID-19 Delta variant causes more symptoms now. So the most common symptoms in children and teens are fever and cough, as well as nasal symptoms, some GI symptoms, and occasionally there's a rash that can also happen. So here's a list of all the signs and symptoms of COVID-19 in children. And so I did underline the ones that are most likely to occur: the fever, the cough, the nasal congestion, and also the runny nose. But there could be others, such as the poor appetite, loss of taste and smell, shortness of breath, nausea, vomiting, diarrhea, muscle aches, and headaches. So here I have provided a symptom chart that you could use as healthcare providers, as parents, as community health workers to differentiate between certain symptoms. And I do want to say that whenever you feel like there's a crossover, I still don't know what to do, trust your gut. Just as you have made this clinical decisions before. If you feel uncomfortable about things, then the patient does need to be tested. And so I'm going to go to a different screen so that you can see the chart. And so here is one of the charts that breaks down the difference between the COVID-19 virus, cold, flu, seasonal allergies, and asthma. And so even the length of symptoms, for instance, for COVID-19, the length of symptoms are from 7 to 25 days, whereas asthma, it happens rapidly, can last for a couple of hours, and sometimes longer. Wheezing is not as common in COVID-19, where it is very common for asthma. Sneezing tends to happen more with allergies, right, than that would happen with COVID-19. A runny or stuffy nose, very common with COVID-19, a little less common in children with asthma. But of course, you know, if allergies were kind of the trigger for the episode, it may occur. So it's, again, there may be a little bit of blurring of lines, but this would at least help you to not make a rush decision because we have so much anxiety related to COVID-19. Everything that walks in the door is not kept COVID-19. Fever. Fever is more common with COVID-19 and less common with asthma. And so hopefully this chart is a little bit of a help for you to decide what's what. So let me go back to my other screen here. So mom wants to know, what forms do I need for school? What do I need? Well, I tell her you need your asthma action plan so that your school nurse knows exactly how to treat you appropriately and what you're taking daily and what they're supposed to do if there's an emergency. You need a physician's report for asthma. You need a medication administration form, and you may need a permission to carry your albuterol or to self-administer your albuterol. And so I'm going to go to this website so that you can see for CPS exactly what forms you will need. And so here on CPS website, it says health forms for parents and caregivers. And if you scroll down, it'll say here, medical forms. And if you continue to scroll, it has medication administration. And when you click there, it tells you physician's request for self-administration, physician's request for administration of medication. And these forms are in English, and for the parents, they're in English and in Spanish. If your patient has allergies, you click here on the box, and it will provide you with the food allergy action plan, your physician's report for a child with asthma, as well as if you need permission to carry your EpiPen or food substitutions. Here, if you click on this box, it gives you for asthma the documentation that you need, which is an asthma action plan, as well as a physician's report on a child with asthma. And I'll just click here just so that you can see the physician's report on a child with asthma. So you do have to put the category, the trigger or severity, trigger, your daily medications, if there are special needs such as exercise modification and things of that nature. Now, mom may ask about a form or a letter because she's concerned that her child has asthma and she's afraid of them getting COVID, and she's very anxious and she wants the child to participate in virtual academy or to be at home while instead of in-person learning. And so there is a form called a medically fragile eligibility form. And so what you'll do is you go to CPS website, and I do have it on my slide, the web address, but it'll lead you here to medically fragile conditions. And if you scroll down, give me 1 second because I need to move myself out the way here. It gives you conditions that qualifies the patient to be considered medically fragile. And if you continue to scroll down, it's going to give you an examples of those patients who automatically are eligible, such as patients with brain tumors, leukemia, rheumatoid arthritis, cystic fibrosis. Now, this is where it may get a little confusing for some parents because asthma is in category B, and it does say unspecified. But the eligibility, it says here, is if your attendance is below 75% yearly. So I don't make up the rules. I'm just the presenter today. That is the criteria. And it does say here, are frequently absent from school, and their absences are directly related to severe or life-threatening physical conditions. A medically fragile student is one whose illness and treatment frequently place him or her in extreme, precarious, or life-threatening circumstances. And so how do you get to this form if you feel like your parent or your patient, I'm sorry, fits that eligibility? Here it says COVID-19 health eligibility form. And if you click on English or Spanish, it's going to tell you exactly what you need to put on the form so that the patient is eligible. All the information that's provided on this form is subject to verification. And so you may need to, as a clinician, provide documentation to support why you have put this patient in a medically fragile, that they're eligible to blah, 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 blah. I don't know why I'm losing it, to participate in virtual academy. Okay, so let me go back to my slide presentation. So we talked about the forms, we talked about medically fragile. And so now mom feels comfortable and she's asking you, well, what else can I do to make sure that he's safe? I have his medication on board. I know exactly what forms I need to provide. I'm comfortable now. What else can I do? Well, I tell them the proper use of your medication and making sure that you have the correct technique and using your inhalers and your spacers. The 3 W's, wear your mask, wash your hands, watch your distance. Make sure that you clean and disinfect. Don't use any disinfectants that have very strong odor. We don't want that to cause an exacerbation for our patients. Routine is important, and most healthcare providers will tell you that. We have a routine when we come in for work of things that we do, ways that we clean up, just to make sure that everything is stays safe and our families are safe. We recommend the vaccination, and also keep your appointment with your specialist and your PCP as scheduled. That is the end of my presentation.
Thank you so much, Melinda. I know we had a few different questions in the chat or comments as well. One of the first questions comes from Hannah, and she had a question about the Delta variant and what's the data on that as far as its infection rate and what kind of data do we know and what do we know about this Delta variant?
And so I actually have that in one of my slides, but what we do know is that the Delta variant is 2 times as contagious as the previous variant. And so patients tend to be more symptomatic with this particular variant, and they're more likely to have more serious complications related to COVID-19 as well.
The one thing that Kristen Stevenson commented on, and I'll just expand on, is, that's just a graphic that the CDC provides that tells you it's more infectious. It doesn't mean that one person would only infect 5 people.
Right.
If that person is standing right there with, 5 people around them, yeah, it's more likely that they're going to get infected, and it's just so much more virulent. So what happens with viruses is basically they change.
Hmm.
They change. They're always trying to be little rascals and get us where we can't, handle it. And sometimes they fail, and sometimes they're successful. So as viruses change their DNA, like we do over time, but they do very rapidly. Sometimes they get it right in their perspective and wrong in ours, and that causes a huge spike. So what we know is Delta is very contagious, and people that are not vaccinated, who don't have that protection, are getting sick. And we used to see patterns when we originally saw COVID, the first part of the pandemic. We're still within the pandemic and another surge right now, as I think everybody well aware of, that initially we knew it was going to be older people that had medical problems. Now it's not so clear. We're seeing young people dying, 16-year-olds, 30-year-olds that have no medical issues. So we need to know a little bit more about how it affects people, but we have so many people that are vaccinated, it's hard to know compared to before what this virulence is as far as severity, but we do know it's much more contagious. There's another question about some of the forms. And so just a point of clarification, a provider does not need to sign off on a form for self-carry. Only the parent has to okay that. And Dr. Vollman put a comment that yes, you only need the child report for asthma for those who are 504. However, I push for almost all of our patients to get 504 plans so that there's a plan in place, so that there's emergency. And so you should definitely advocate for that if you feel it's right for your child or your whomever else, you know, that you might be treating in any capacity. Do you have anything else to add about the virulence of the variant? And Melinda, sorry, I just kind of
No, not at all. No, I think that you covered it well.
Okay. I knew that's a really tough question because we're comparing it to something that we never saw before, and some people are vaccinated, but it's very scary.
Yeah.
Does anybody have any other questions for Melinda? She's got a lot of experience with working with children and some things that might make you hesitant about going back. Anything else that you can think of? That's a great question. And so I think because my daughter is 5 and she can't or not with her asthma, our specialist didn't think she was back last year. Can you answer that, Melinda?
Okay, I'm sorry. I was just able to take a look at it in the chat. So because the patient has asthma does not necessarily make her more vulnerable to COVID-19. And so the thought is that the better prepared she is, or the better controlled her asthma is, then the better her outcomes will be. And so just because a patient who has asthma becomes infected with COVID-19 does not mean that they're going to have a more severe case of COVID-19 compared to someone else. The data just doesn't show that. Would you agree, Dr. P?
Yes, I mean, I think initially in the pandemic, we didn't know. And so chronic lung disease and moderate to severe persistent asthma were placed as one of the risk factors. However, more data has shown that in some cases, with those that are on chronic oral steroids, we need prednisone orally all the time. And you know this because the booster has just been recently okayed for those who are immunocompromised, and anyone who's on 20 milligrams of prednisone or more daily is eligible for the booster vaccine now as a secondary immune defect. That asthma itself, if it's controlled, is not a risk factor and may actually be protective if it is the allergic formulation, but more information will need to be gathered on that. And they're currently doing an NIH-based study called the HERO study to kind of look at that further. And the Delta is more contagious. And some of the data coming out of Lurie and other places with the infectious diseases that younger children can can have issues with the amount of virus that's in their nose. Do people with asthma have more trouble wearing masks? And then there's another question too about a cough and K95. Whether or not that those are enough against the Delta variant. And then after those two questions, we're going to move on to Lorraine.
And so the recommendation is the N95 mask. But if you don't have access to a N95 mask, will the cloth mask be okay against the Delta variant? And so I believe that the experts have said, yes, that the more layered that it is, the safer that it is. And of course, if you have a filter that you can put also inside of the mask, can be an additional protectant against the Delta variant.
I think number one, we need to be wearing masks. And I think that, you know, any mask, I don't care what mask you're wearing, just put a mask on. All of your children and all of you, no matter where you're at. And even if you're outside in close distance, wear a mask. And I'm telling that for all the families that, that's very important. The type of mask is important, but I mean, honestly, an N95 is not going to be feasible for a child throughout the whole day of school. It will be difficult for someone to breathe through. Children can learn and do know how to use masks, and a person with asthma does not have a risk of hypoxia or anything to that nature. Now, if you ask somebody to run a marathon in a mask, they're going to have some difficulty. If you ask someone to run a 100-meter dash with a mask, they're going to have difficulty, asthma or not. If you have severe persistent asthma, of which you are, and you have other problems like COPD, you're on oxygen, even those people have been shown that they're okay with wearing masks, but you don't want to be going about like, you know, running up flights of stairs doing that, okay? All right, and so the other questions about the forest fire, all of those things are great. Let's save those to the end. Can you hold those questions? Because I think those are great for the open forum. And then we can talk about the classroom instructors. Thank you so much, Melinda. I really appreciate. And I think that the question about the routine cleanings and the best practices are going to be answered just momentarily. All right, and so I'm going to introduce our next speaker. Thank you so much. If you can put on your video, Miss Lorena Alba. She is the Director of Education for the Asthma and Allergy Foundation of America, and we're so happy to have her because so many of the questions about how to clean and masks are really available in a lot of the tools that she's helped create. So she's the Director of Education, as I mentioned, and a certified asthma educator. She oversees all of the AAFA's content and curricular development for patients and caregivers, clinicians, and non-licensed educators for asthma, allergies, and food. Allergies and food allergies, rather. She's showing her food in this picture, and so she's making me hungry because I haven't had dinner yet. And she's played a key role in the creation of the COVID-19 Resource Center that the AAFA has put out. And I've used this in multiple different presentations, and it's essential information that I think everyone can get something from, whether you're an educator or a parent or a provider or a school nurse. She developed as well Asthma Basics, which is through the American Lung Associations, and an online learning program for those with asthma, and Open Airways for schools, which is an online facilitator training. And she's co-founded the California Department of Public Health's Asthma Management Academy, or ASMA, how perfectly named, which is helping train the trainers for professional development program that focuses on unique training needs of the promotoras de salud and the community health workers who conduct in-home asthma interventions. We're so happy to have you, and take it away.
Thank you so much for having me. Can you all see my screen okay and hear me just fine?
Yes, and yes.
Perfect. My four-legged roommate is with me today. I have hid all the squeaky toys, so I'm hoping that we'll have, he'll be quiet during the presentation, but please excuse me if you hear him. Well, thank you so much for having me today. Welcome to the webinar. And I'm just going to go over some of the resources that we have at the Asthma and Allergy Foundation of America. And I would love for this to be interactive. So if you have any questions during the presentation, please feel free to put them in the chat. Dr. P will help moderate them. I'm going to ask some questions during the presentation. So please feel free to share your concerns, your challenges, and even some of the solutions that you might have found for some of the challenges we're going to talk about today. So I am Lorraine Alba. I'm the certified asthma educator and the director of education for AFA. And AFA does have a lot of resources to help families and schools prepare for the new year. This includes information on asthma, allergies, and food allergies, as well as COVID-19. I'll be talking about managing asthma in schools, building on some of the things that Melinda shared with us. But how do we manage asthma while reducing the spread of COVID-19? We do have a COVID-19 and asthma toolkit for schools. We created it for the school year last year, and then nobody went to class, right? It was mostly all virtual. So we've had the past year to kind of tweak it and get it into a really great place. And so we'll be sharing some of those resources today. You can download the toolkit at the link here at the bottom of the screen. And it has all types of policies and steps that you can take to create asthma-friendly schools while reducing the spread of COVID. And we also have great checklists that can be used every day by school nurses, school staff, school administrators to make sure all of your protocols are in place and kids are as safe and healthy as possible. So 2021, what is going to be different? There's going to be a lot of things different this year. First, we had new asthma management clinical guidelines come out in December of 2020. So we are going to see new inhalers in school, and I'm going to talk about those asthma treatments in a moment. The CDC has recommended no nebulizers in schools because they can aerosolize the virus. So therefore, asthma action plans are going to be more important than ever because kids are going to have to bring their own inhalers into school. We could be looking at a twindemic. Even though the flu numbers were really low last year, as kids go back to school and people are going back to work, we might see higher flu numbers, and you can get the flu and COVID-19. Kids are going to be exposed to new, different, or more triggers since the schools have been closed. It'll be interesting to see what new triggers or things that have happened in buildings that we now need to be more careful of. And then we have developing and implementing appropriate COVID-19 protocols, right? We want universal masking, we want asthma-friendly policies, and we want to look at cleaning and ventilation. We don't want the protocols to reduce COVID-19 to actually exacerbate anybody's asthma. So the first recommendation I wanted to talk about was, again, that CDC has suggested no nebulizers in schools. They're not using nebulizers in the clinical setting either because it can aerosolize the virus, as I said. The challenge with this is many-fold. One is, last year we had a problem with the shortage of albuterol inhalers, right? If nobody's using nebulized medicine, then they're all using inhalers. And this includes hospitals, clinics, doctor's office, and at home and in schools. Does your school stock albuterol? And if you do, is it only nebulized albuterol? Can students self-carry or self-administer? And they could have poor inhalation technique, right? The benefit of using a nebulizer is it's not technique dependent, and most everybody can do it easily. Not so much with an asthma inhaler. We know that 80% of people or higher use their inhaler incorrectly. So what are some solutions? Can your school stock inhaled albuterol? If you don't have spacers, can you use disposable spacers? You can buy these relatively inexpensive. They're like a paper cardboard type of spacer. Doctors' offices often use these when you go in for lung function testing. Can you assess the maturity and ability of a student to self-carry and self-administer, right? All 50 states have laws that say a child can self-carry and self-administer. Sometimes schools try to override those state laws. And the American Lung Association has a really great assessment tool that is online. It's free to use, and school nurses parents, doctors can use it to ask some questions and to assess if a child is mature enough and has the skills to be able to self-carry and self-administer. So do we have any questions about nebulizers or, stocking albuterol or any challenges with that?
And she's totally okay with being interrupted. So it's okay if you have a question and you want to just
Yeah.
jump in, chime in, or put it in the chat.
Yeah. Okay. So we'll move on to the next slide. But again, feel free to put your questions in. Another solution is to ask families for an extra inhaler or an extra spacer to be kept on file in the nurse's office, right? We know that kids misplace their inhalers. We know that they lose them. We know that they forget to bring them from home, right? Is it locked in their locker while they're out on the field playing sports, right? So what are some ways that we can make sure that children have access? And in our toolkit, we have a sample letter. It's in English and Spanish that the school nurse can send home to the family asking for a second inhaler and spacer that can be kept on file in the nurse's office. The family can give this letter to the doctor and work with the doctor. A lot of times if the doctor prescribes one inhaler for home and one inhaler for school, and the same with the spacer, they can get 2 inhalers at the same time. So using this letter to work with the family can be extremely helpful. So the next thing I wanted to talk about was some of the new recommendations for taking controller medications. And controller medicines are inhaled corticosteroids that reduce the inflammation in the airways. They provide long-term control, which reduces asthma symptoms and episodes. So we might see some new inhalers in schools. Per the 2020 focused updates and the clinical guidelines, there's new recommendations for taking inhaled corticosteroids. In the previous guidelines, the recommendation was you took it every day as a controller medicine, once or twice a day, and then you used your quick relief medicine, also known as a short-acting beta agonist, to manage sudden symptoms. If a student is managing their asthma well on this treatment plan, they can absolutely stay on this plan. There's no need for them to change it. They can continue to take a daily controller and then use their quick relief for symptoms. However, there's a lot of evidence that says you don't have to take a controller medicine every day. You can actually take it intermittently or as needed. So the new focused updates say that you can take, instead of taking it every day, you take your inhaled corticosteroids or daily controller medicine at the same time that you use your quick relief inhaler to reduce symptoms or to stop symptoms when you're having them. So you take it one right after the other. Some people like to take their quick relief inhaler first and they think that opens up their airways, and then they take their inhaled corticosteroids. I'm not sure it actually works that way. But anyway, they just want to take one right after the other. It doesn't really matter which one they take first. So if this is the case, you might actually see, along with an albuterol in the school nurse's office, you might see an inhaled corticosteroid. And the dosing is—
Does everybody know what an inhaled corticosteroid is? That's like, the Flovent or the Asthma or the Q-Bar. That's by itself. And
Yes.
then the other ones like Symbicort or Dulera are the ones that would be used for that smart. Oh, you're going to go over it. Never mind.
Oh, no, thank you, Dr. P. I appreciate it. Yes, so this is just a recommendation for inhaled corticosteroids, which is one medication. It does not include the combination medicines that also have the long-acting beta agonists in them. So like the Dulera, the Symbicorts, things like that, those are not included. This is strictly an inhaled corticosteroid, like Flovent, Pulmicort, Asthma, Q-Bar. And we'll share these slides so you all will see all these, so you can have them for reference. People always ask about the dosage. It's 2 to 4 puffs with a quick reliever and up to 1 to 3 puffs every 4 hours. So again, some of the challenges you're going to see at school is now kids have to have 2 inhalers at school if they're on this regimen. It could possibly be 2 different delivery devices, which is 2 different inhalation techniques. And the kids need to remember to take them both at the same time. The other protocol we have or treatment plan now in the new guidelines is called single maintenance and reliever therapy, SMART for short. SMART has been around in the UK and Europe for a very long time. There's an overwhelming amount of evidence that shows this is a very effective treatment for asthma. And so the recommendation is for people 4 years and older who have moderate to severe persistent asthma, they use 1 single inhaler, which is the inhaled corticosteroid that reduces the inflammation, along with a long-acting beta agonist, which keeps the muscles from tightening around the airways for up to 12 hours. And this is actually a combination medication. There are 2 medications that can be used for this. Budesonide or mometasone, along with formoterol. And so those inhalers are Symbicort and Dulera.
Lorraine, there's a question in the chat that's saying, this is only for 12 and older. My daughter takes Advil and budesonide twice daily at home.
I will have to look. It could be that I have this incorrect. We have this for 12 years and older. For moderate to severe asthma, they can take their inhaler both ways. They would take the Dulera or Symbicort once or twice a day for control, and then they would also use it as their rescue inhaler.
And so I think what might be the issue is that the medication is approved. Advair can be used in a younger child than 12. It's just the way the guidelines are stating is to use that 1 specific or 2 specific inhalers as a reliever also is a little bit different.
Correct.
So Advair wouldn't be used in this case in that way. This is just to use, it's very confusing. It's very confusing. So this is only to use it as a reliever in addition to an everyday medicine. Not right. The one that Advair and other budesonide can be used in younger children. That's not a problem, Hannah. Absolutely.
Right. Yeah, so Advair is not on this list to use as SMART. It's only Symbicort and Dulera. Mainly because it has the formoterol. Formoterol is a long-acting beta agonist, but it also works very quickly. It can open the airways within 15 minutes. So it works just like an albuterol, but it also has the added benefit of keeping the airways open for up to 12 hours, whereas your typical quick relief medication only lasts for 4 to 6 hours. So, part of the challenge here is that this is brand new. We have told people for a very long time to never use their long-term control medications as quick relief because it won't work. But the truth is, if it has formoterol in it, which again acts very quickly, it can be used as a quick reliever. And then again, for people 12 and older, they might need a higher dose. So it's recommended for them that they would take Dulera or Symbicort twice a day and then use it as quick relief as well. And then the SMART ages and dosing, 4 years and older, up to 8 puffs a day. And for 12 years and older, use both daily and needed and up to 12 puffs. And I just want to say that this is not, just like your quick reliever, you would not want to use this constantly and not talk to your doctor. If you're in the yellow zone on your asthma action plan, you should talk to your doctor. SMART would never be used for more than 5 days or so. If your symptoms are not improving within 24 to 48 hours, you definitely want to contact your healthcare provider. So any other questions on SMART, or Dr. P, anything to add to make sure I hit all the points?
You did a great job. It's just, I think what's going on is this is a total change of mindset, that some of the medications that we've been using every day, whether you're needed or not, which we continue to do, can also be used instead of albuterol. And the reason is because the albuterol, we're not so sure that's the best reliever. And perhaps adding the inhaled steroid, which also can decrease inflammation, and having a longer acting formoterol is the better way. We may see in a few years albuterol completely be replaced. And so I don't know what's going to happen because we're waiting on more studies, but it is a total shift in mindset. So Hannah's question is absolutely like spot on. Wait, what? What am I doing now? And so you'll stay tuned, but it'll play out over time, but we're going to start shifting what we think about in how we treat asthma and for whom and how, and in what ways we're going to give relievers and every day. And it's a good thing. It's just confusing at first.
It's very confusing, again, because it's the total opposite of what we've told people for all these years. And, this is in the global guidelines. Again, this has been used in Europe and the UK for a very long time and has great efficacy. Also, the challenge here in the US is that the FDA has not approved these medications to be used this way. So, the medication box doesn't, or the pamphlet doesn't say you should use it this way. It would be an off-label prescription. School nurses might have trouble getting an extra one to have in the office because, a student might not, they might not be able to get more than one because the insurance formulary might not cover it. So just things to think about. So we do have some checklists in our toolkit as well for checking for medicines, for stock albuterol. Can the children administer and self-carry? So asthma action plans. Just want to go over these very quickly, which is, why do you have an asthma action plan? It's really important. They're written directions on how to manage a person's asthma. They're for both adults and children. They explain the what, when, and how of taking medications and when to take them. And they also explain the signs and symptoms of worsening asthma and how to respond to a breathing emergency. And I think one of the most important things is the goal of an asthma action plan is to guide self-management first and foremost. I know that schools like to have a lot of information on the plan to help for what they need, but really the patient should be using the plan to make, to guide their self-management. It's really for them. I'm always thinking about food, so I like to think of asthma action plans as a recipe. The ingredient list is your medicines. Your mixing and cooking instructions are when to take the medicines, which one to take, and how much to take. And hopefully, the end product is well-controlled asthma. The twindemic. I mentioned that flu cases were down dramatically last year. It's too early to tell if cases are going to be up or down this flu season, but either way, we really need to plan for a possible twindemic, right? So, it is possible to have both the flu and COVID at the same time. Some solutions like Melinda talked about is really the vaccines for students 12 and over, for staff and faculty. Flu vaccines as well, especially for people with asthma. They're more likely to have complications from pneumonia. What we don't want to see is people not getting flu vaccines because they're thinking all the protocols they're taking to protect themselves from COVID-19 is going to also protect them from flu. That is true, but the best thing that they can do for themselves to protect themselves and others is to get the flu vaccine, especially if they didn't get it last year. AFA recommends universal masking and physical distancing, as well as symptom checks and hand washing and sanitation stations. Melinda was kind enough to show our chart in her presentation. This chart is specifically for schools. It does have some extra information here about what schools can do to manage COVID and asthma. And we also have it in Spanish, and you can find that on our website. So trigger identification and reduction. You know, along with the flu cases being down, we also saw a drop in pediatric asthma episodes. Melinda kind of talked about some of those reasons why. You know, kids were not exposed to all of their triggers that they get at school. You know, now they're heading back to different classrooms, and we need to worry about new, old, and different triggers. You know, school buildings have been closed for a very long time. What has happened in those schools? Has there been pest infestation? Has there been dust and mold? Is there water intrusion? You know, I'm very concerned about additional cleaning and disinfecting. You know, are schools going to use toxic cleaners and disinfectants? Are they going to be doing it more when kids are around? Are they going to be kind of over cleaning because of some hygiene theater, and they feel like, you know, parents and occupants of the building will feel more comfortable if they're constantly cleaning and disinfecting, even though we know the disease is airborne, and all of that cleaning is probably not necessary. Kids are going to be facing the stress of coming back to school, right? What have students dealt with emotionally while they've been at home? Have they been caregiving for people who are sick? What's it been like to go to school virtually? Did they lose any family members or loved ones to COVID-19? What are we going to do about classes and PE? You know, there's been kind of a push about having classes outside. Well, that's great, except for kids who are allergic to ragweed or grasses, or their school is next to a highway, or there's wildfire smoke outside. So, you know, what happens to those kids? And are there asthma-friendly policies? You know, are there fragrance-free policies? Is there no bus idling? You know, are we making sure that faculty and staff are not bringing cleaners in from home to use to try to disinfect their own classrooms? And again, we have some checklists here to really help with looking at the environment. You know, we've seen schools, you know, lightly spray bleach and water into the air and onto desks to try to disinfect and kill the virus, right? That's not good for kids or anybody's lungs. Again, don't let school staff bring in their own cleaners. You know, use the right size air cleaners and purifiers. Change the filters often. You know, you're not going to be able to follow all of these things on the checklist, probably. You won't be able to get all of them, but the more you can get, the better. And again, this is just a great way to look every day to make sure you have everything in place. Melinda mentioned September peak week, which is asthma epidemic week. It's the third week of September. Asthma episodes and hospitalizations are at their highest. It's the perfect storm, as we already talked about, of allergies, asthma, and viruses. You know, as children return to school, they're exposed to new viruses, particularly rhinovirus and other asthma triggers. The mold count is up. There's high ragweed season with 17 different species of ragweed in the air. So this is just a really difficult time, and I think schools need to do
Hello, Lorraine, I don't know if we can hear you. I think she might have gotten kicked out. Okay, I thought it was my internet too. All right, so what we're gonna do is, while she's coming back, I want to invite everybody to to kind of go back and look at some of those questions that you had, and feel free to open up your video so that we can move forward with the question and answer forum. And then if Lorraine has any last parting things to join when she joins us, that would be great. Thank you, Melinda, for turning on your video. So if anyone wants to shout out a question, or I can go back to some of the remaining questions, either one is okay. So one of the questions was a really good one, and I think I'm going to wait for Lorraine to come back on, is that about the best practices for classroom instructors. And she has some really great information in the packet there that we're going to make sure that everyone has access to. Now, as far as the pervasive wildfires go, do you have any comments on that, Melinda? I know I definitely have some things to say, but I think that would definitely be something that we can bring up and talk about now.
Well, I know that we do know that air quality definitely is a huge trigger for asthmatics. So especially with the humidity that we've had lately, in addition to the air quality, I think it definitely causes more problems for our asthmatic patients.
Definitely. And one of the things that Lorraine was really commenting on, and I think she's coming back on now, is that all of these things are going to influence our children's asthma, right? And they're all compounding. You've got multiple viruses that are, the Delta variant's going crazy. You have schools that have been locked up and not, or overcleaned, or both, having infestations and being overcleaned. Somehow this is not uncommon. And then you have the problems with what masks to wear. You have the problems with the air quality being horrendous because of idling, which we're hoping will be less with some of the recent legislation, the laxity of environmental policies, lots of various different things that are influencing our children's asthma and our own asthma as adults, or our own air quality affecting all of us in many ways. Pulmonary disease is more common in areas of air pollution with different particle matters, and that wildfires are not helping the situation, which is already bad. And also the climate change, which is bringing on those changes to be more likely to have wildfires. And I think that's a whole nother issue that we're going to be addressing in a CAC upcoming forum in the winter, is to talk a lot more about that. And so stay tuned to some more specific information for those that are like boots on the ground, trying to get policies and grassroots education out about those issues. So I think that was just it's perfectly well timed. We're beginning to understand some of the health effects as these wildfires become, unfortunately, more common. What other questions do people have? I mean, anyone can ask a question. And Lorraine, if you can also jump in if you had anything else to say. And feel free to put your video on if you prefer to. We'd love to see you.
I'm so sorry I disappeared. My power went out for a minute.
No problem. I thought it was my Zoom. I was taking all the Wi-Fi off, yelling at the people downstairs. Oh my goodness. It's just like my usual go-to. Anyone else have a question, worry, or concern? Do you want to share anything else with us, Lorraine? I think you might have had a few more slides.
Yeah, let's see.
Go ahead and share screen while other people might have some more questions.
Sure. All right, I think you guys might see my wrong screen. Let's try this again.
And again, feel free to ask any questions to either of our presenters if you have them, and put them in the chat while Lorraine's bringing them up, or after she's done sharing some more of her great information. And the website, I think if Kim can share it again, would be great.
Perfect. Yeah, I just had a couple more things, some resources I wanted to share. We have an award-winning blog, and you can find a lot of our information on our blog as well as our website. We do have some tips for preparing for school when your child has asthma or allergies. They offer these great 10 tips of what you should do, even if school's already back in session. This is great information for parents to make sure that they still have everything, and for school nurses and administrative staff to share with families to make sure that they know everything that they need. And then I'm happy to take some questions. We have some more, my contact information's here. You're welcome to contact me if you have any questions. Again, we'll send the slides out to everybody. But we have some more resources here. I won't go through them all. You can use them when you get the slides, but we do have the COVID-19 Resource Center that has information for people with asthma around masks, vaccines. We update it almost weekly. The school toolkit is updated quite often. We have some information about asthma capitals, where you live and how it affects your asthma. Our award-winning blog, like I said, our online support communities, please check those out. And then some courses we have to help people learn about asthma and allergies. So that's all I have, and I'm happy to take any more questions if you have them.
There's a great question in the chat that just like
Sure.
totally speaks to me, but I want to see what you guys, how is the school-based asthma management law that was passed this past January, and I'm guessing the one nationally is what you're referring to, impacting the school planning for children with asthma?
I'm sorry, you were breaking. Let me look in the chat. I didn't quite.
Yep. How is school-based asthma management law that was passed back in January impacting the school planning for children with asthma?
You know, everything is all over the place. Every state's different. Every region, every school is different. You know, trying to get people, I think, to understand the science and what's important, you know, and again, we're taking a very kind of hard stance on, you know, universal masking and requirements for everybody to get vaccinated. And I think that from what we're hearing from schools is that some of this asthma, you know, asthma-friendly schools are not happening because the COVID planning and protocols are really kind of taking over what needs to happen in schools. And, you know, we're seeing schools purchase air cleaners and UV lights and all kinds of things that have no real evidence behind them to keep kids safe from asthma or flu or COVID-19. And so we've just seen kind of, I hope this answers the question, but we've just seen school planning all over the place. You know, and even with food allergies, right? Kids can't eat in the cafeteria. So now food allergens are in the classroom, and how do you manage that? So there's just really a lot to think about, and I'm not sure that schools have done a great job at planning for anything.
I think that the legislation was important, but the timing was difficult because exactly what Lorraine's saying, because COVID-19 has taken over. And so that's first and foremost, and asthma kind of gets left in the things that we're doing for can impact asthma. But however, I think that it also presents an opportunity. And so you can think of it from both ways. If you have national legislation that supports and incentivizes states, part legislation, in large part because of a lot of states don't have it. However, to really focus on asthma management and chronic disease management in schools, if we could do all these things for COVID, we're managing these severe viral illness that can provide and help us build infrastructure for chronic disease management moving forward. And that's the positivity that I'd like to see. You know, that legislation, it might not be on the first and foremost, may allow us to have some work there for the chronic disease and management implementation now that we've had to implement pandemic restrictions in schools.
I think it's important too that just because a law passes doesn't mean that it's implemented.
Yes.
And, you know, schools, districts quite often, you know, I see it with self-carry laws, you know, they have their own kind of protocols that they want to do, and they, they just kind of do their own thing for what works for them. So it'll be interesting to see what happens this year.
Exactly. I mean, and that's why there's many of us that are working on implementation of stock albuterol and other things. And that's
Right.
an area of interest of mine in particular, because we need to take policy to individual level. Like it just can't remain this kind of like nebulous thing that we need to take it into action. So I think that's a really, really good point. And one of the follow-ups here to that could be another question in the chat, which is, do many Chicago schools use the EPA air quality flag program? And I don't know. I don't know the answer to that. Does anyone else?
I know.
I'm not very, go ahead.
I was gonna say, I know nationally the flag program has really lost a lot of implementers again, and its appeal. I do know certain pockets where it's done, but it definitely seems to have fallen. I know when I got into this work 15 years ago, it was everywhere. And I think it's a really great way to let people know about air quality very easily, especially with climate change, but it doesn't seem to be implemented nationally very much anymore at all.
I'm going to ask this question because we're going to go into that next, like later in the winter, and just kind of have some of our experts in that area address that specifically in their talks. I'm writing it down so I don't forget. That's a great question. Krista Stevenson asked another good question. If a parent isn't as proactive as we'd love them, need them to be, what are some approaches schools or administration can do or should take to implement some of these measures we discussed?
Yeah, I can take that. I would love to hear Melinda's what ideas she has. Go ahead.
Yeah, I mean, I'm assuming that you're talking about the child wearing their mask as often as they should, or if you're talking about the patient starting on their medications prior to school starting, or making sure that they're bringing the forms in or giving the albuterol. Whatever the case is, education is key. And so I just don't think that we should grow weary in our good doing. We just need to continue to let parents know why these things are necessary as much as we possibly can. I think that's all that we can do. We can't make people do anything, but we can inform them the best way that we know how, so that they feel empowered and that they feel like their concerns are heard as well.
We're partners in all of this. We are here to help and educate. People are busy. This is a stressful time.
Yeah.
I mean, I think everyone knows that, people just are really stressed out. They might be going through things that we can't even imagine in their lives. And so if we remember that we're humans first always, and we approach every child and their caregiver in the same way, that with that understanding, it's repetition. Like these are the facts. You deserve to hear the facts, and I'm here for you to support your child. This is what we need. That's kind of how I approach it, or try to, as a clinician. And I try within the community partnerships that I help forge and maintain, because this is what we're all about. We want children and our adults that have asthma to be able to breathe easy and live life the way they need to and the way they want to, where they're not held back. And so however we can partner, it's this patient-directed care. We're not driving care to somebody, we're with you. And so that concept is interestingly new in quotes, that people partner. And I think in time we'll see a shift. I hope. I'm always hopeful, but it's very difficult to sometimes engage when someone's doing so many other things. And so perhaps we need to understand how those other things may interfere with or keep somebody from being involved, because we know people care about their kids. I mean, it's pretty universal.
I think, you really have to meet people where they are. And this has been a really difficult year. And especially if their child's asthma has maybe been super well controlled while they've been home and in a different environment. And now kind of having to start all over, and everything else we're going through, especially with the Delta variant. And again, I think meeting people where they are and becoming partners. And, we really recommend and start in the early summer to try to get families to start working with school nurses then. What materials do you need? Get your doctor's appointments. You can't, a week before school, you can't try to get your asthma action plan, right? You need to get that sooner. And to really help families through the process so they're ready on day one instead of the week before that they're, really rushing around trying to get everything they need to get their kids ready for school, with asthma action plans and 504 plans and everything else. It's a lot.
I completely agree with you. I'm not really for sure when the deadline is this year. It's usually October, if I'm not if I'm correct about the deadline to making sure that the forms are in. But a lot of parents have expressed to me that it's very difficult for them to get appointments, to see their providers at this time. Some of them just became comfortable with going back out to doctor's offices, period. So there are a lot of challenges, a lot of barriers that a lot of parents have had to face. And so I think our assumption shouldn't be that it's because of lack of care, that sometimes it's just because they haven't had the resources the same as they have before, or they had some anxieties related to kind of getting back out there and getting to their doctor's appointments. So us just trying to be as supportive as possible, making things as easy as we possibly can. Those 90-day prescriptions helps a lot. Making sure that when we do prescribe things that we're giving 2 inhalers, if possible, if the insurances will cover it, making sure they have enough refills. Just trying to make this process as easy as possible this year, because there are so many things that are going on that can kind of throw parents off track.
I really appreciate everyone coming out on a busy evening. We know your time is precious, and we're so thankful that you spent the evening with us and really focusing in on how we can keep our children and our staff and our teachers and our nurses and everyone safe as they go back to school. And honestly, all of us, because what happens within the schools affects everyone, whether you have a child there or not. And so I really do appreciate everyone coming out, and I want to thank our presenters. You've done an amazing job at really giving us some great resources for how our families and our staff and schools in general could really approach going back to school with a little bit less fear and more information. And knowledge is power. So thank you for providing that knowledge today. We have an upcoming online forum with our next CAC Asthma series that I'd like to just put a plug in for on the spectrum of asthma and what's really coming up in the research now, from children to adulthood. And so what's the new in asthma with research? So I'd really love for you to join us. It'll be a great time. We have some amazing speakers like Dr. Kumar from Lurie Children's and Dr. Krishnan. And it's just really going to be a way that we can look to see what we have available and down the pike for asthma. And there's some very exciting stuff happening. And if there's any other questions, feel free to put them in the chat. Otherwise, please fill out your evaluation and become a CAC member. Go to our website, fill out the forms. We'd love to have you. We're always looking for new perspectives and to have you help us figure out what's needed, what you're interested in, like that air quality programming. I think that's something we can address in a later forum in the winter. So thank you so much, everybody, and have a wonderful evening. And happy back to school. Thank you so much, Melinda and Lorraine. You did such a great job. I really liked it. I really hope that you guys enjoyed it too.
Thank you, Dr. P.
Yes.
I was so nervous.
I knew you were when I was texting with you
Great.
earlier. You were like, you didn't start the link up. Oh no, she's nervous. I already know.
Yeah.
There's no reason to be. You're a wonderful speaker and you provided such great information. So I really
hope so.
appreciate it.
You
I
couldn't
hope
tell
so.
you were nervous at all.
My
No.
gosh.
No.
And not in your speaking. I just knew beforehand.
Yeah.
Yeah.
Thank you.
But, you know, we hope that you guys, you know, Melinda especially, we'd love for you to get more involved in the CAC. So please, you know, become a member. We'd love to have you get involved. I mean, we are at the front lines here, so it'd be wonderful to have you. And Lorraine as well, of course.
Mhm.
You know, because I have to just be honest with you, those resources have been my lifesaver for so many presentations and able to like really give people some like checklists. I think that's what people need, checklists, especially when we have no control over a situation.
So true.
I need checklists to get through this. If I don't have one, I don't know what to do. I mean, honestly, it's very helpful. So thank you.
Oh, you're welcome. You know, I was so excited that Melinda showed our chart. And when we first created that, you know, the CDC called us and said, our task force can't get this information out. We like need you to do it. And it was quite interesting. You know, I guess like sometimes NGOs don't have all that bureaucracy, but for a long time, you know, we were the ones getting the information. Like CDC was asking us to do stuff in
Wow, I had no
offline
idea.
phone calls, you know, because they couldn't get anything past their original task force.
Wow, I'm so happy that you were able to do that for them and like get the information out. And Lorraine, I hope that we work together in some capacity in the future because I have a large interest in asthma policy and just air quality and all these things. And it seems to me, even though I have like no legal training, that's where I really have passion for, because if you can't make it a policy, nothing's going to change in many cases. So yeah.
Absolutely. And we just did a constituent survey, and